Good day to everyone. My name is Mary Jane Evangelista from Hersing University, Psych NP student. Today, I will present to everyone my chosen illegal drug that is prevalently being abused in our society. And that will be, of course, the methamphetamine. Okay, what is methamphetamine? Okay, methamphetamine refers to a powerful, highly addictive stimulant that impacts the central nervous system. And also, methamphetamine is considered or resembled to a glass fragment or shiny bluish white rocks. And also, it has similar chemical characteristic as amphetamine. And what is amphetamine? Amphetamine is also used to treat ADHD and narcolepsy as a sleep disorder. So individuals can take methamphetamine by what? By smoking, by swallowing as a pill, snorting, and injecting the drug dissolved in a water or alcohol. What will be the history of meth abuse? According to the history, methamphetamine is also known. The other name is meth, crystal, or speed. And also, it was derived from amphetamine, which was widely prescribed in 1950s and 1960s as medication to treat depression and obesity. Okay, and the next, by 1967, it has a total to 31 million prescription, and also from 1980, MA or meth abuse, illicit use, and manufacturer was endemic to California, later spreading to the other region, particularly Midwestern state. And about 2.1% of the population or 4.7 million American have tried meth at least once in their life. So that will be the history of the meth abuse. So what will be the meth prevalence and epidemiology? According to NIDA, or the National Institute on Drug Abuse 2022, among individuals from the age 12 and above in the year of 2020, about 0.9% or 2.6 million people reported to have used meth in the past 12 months. And about 0.2% of 8th grade, okay? And then 0.2% of 10th grade and 0.2% of 12th grade reported to use meth in the past 12 months in 2021. And among individuals aged 12 and older, around 0.6%, or of course, 1.5 million people had meth use disorder in 2020. And in 2020, an estimate of 23,837 people die because of what? Methamphetamine overdose. Okay. What will be the risk factor and vulnerable population? Okay. The risk factor will be what? Will be the other factor that increase the likelihood of using meth include readily available. Okay. And then also the environment and the age, usually the teenager, right? The teenager or the 7th, the 6th grade, the 8th grade, that will be the risk factor out of curiosity. Okay, and then also another one, they are curious about, the effects, because according to the meth causes temporary heightened euphoria, alertness, and energy. Okay, and then also the meth increases dopamine level, which enhances the body movement, motivation, and bolstering the reward system. So that will be the risk factor. And then the population that will increase the risk of meth abuse or use are the following: men who have sex with men or sexual minorities. Okay, and then women, criminal offenders and sex worker, and homeless and psychiatric patient. So that will be the risk. Okay, And then, of course, my personal experience during my clinical. So 90% of psychiatric patients are using methamphetamine, cocaine, or drug abuse. Okay, that will be from my personal experience. Okay, so the next, short-term and long-term side effects. Before I will discuss the short-term and the long-term side effects, I would like to inform you that using even a small amount of methamphetamine can generate similar health effect as cocaine or amphetamine. Okay? So what will be the short term? Short term, decrease appetite, increase wakefulness and physical activity, faster breathing, right? And of course, rapid and irregular heartbeat, and increase blood pressure and body temperature. That will be the short term. Okay? And the long-term side effects include the following: increased risk of contracting HIV and hepatitis B and C, okay, because of the injection, right? It can be the cause. Worsening progression of HIV and AIDS, extreme weight loss, addiction, severe dental issue, anxiety, changes in brain and function, confusion, sleeping problem, paranoid, hallucination, and violent behavior. So that will be the short-term and the long-term side effects of methamphetamine. Signs and symptoms of abuse upon assessment. As a psych NP or advanced practitioner, we have to what? We have to know what will be the signs and symptoms of abuse. Okay, that they are in meth abuse upon the assessment. What are they? Number one is increased heart rate and body temperature, flash, bruise, or scab skin and itchiness, dilated pupils and rapid eye movement, hyperactivity, uncontrollable and erratic twitching and weight loss. And of course, in terms of psychological symptoms, the patient will exhibit anxiety, depression, intense mood swings, agitation, hallucination, everything about, about psychological symptoms. In behavioral symptoms, okay, they will exhibit like, loss of control over life, continued abuse, loss of interest in activities, hygiene, withdrawal from family and friends, and that will be from behavioral abuse. Okay, so we have to be mindful the signs and symptoms of meth abuse upon assessment. Okay, the potential for overdose or use as suicide weapon of choice. Individuals can overdose on methamphetamine or meth abuse. An overdose can occur when individual uses excessive drug and toxic reaction as follow. Okay, resulting in a serious, harmful symptoms and can be fatal. Okay, and according to NIDA, 2019, approximately 15% of all drug overdose death in 2017 had a link to methamphetamine. Okay, and then street meth can contain cheap, dangerous synthetic opioid. The user is unaware about that. Meth-related suicide constitute a higher percentage of meth-related deaths from according to Dark et al. 2019. And also, individuals can commit suicide by overdosing on meth abuse. As you can see, this is a chart, right? This is a chart that explaining the U.S. overdose death involving meth in people aged 25 to 54 years old. And also, as you can see, there will be a color-coded, where the blue is from American Indian, okay, American Indian, Alaska Native, okay, red or pink is white, non-Hispanic, okay, and then of course, U.S. average is the gray, Hispanic, light blue, purple, Asian or Pacific, non-Hispanic, and of course, green, a black, non-Hispanic. And then you will see also the year from 2011 from what? 2018. Okay, next. So the big question is, what will be our patient care plan for this particular meth abuse patient? Okay, what to do? As a Psych NP, you know, Psych NP student, we have to know the what? The meth patient care plan. So number one, meth addiction can be treated using the following intervention. In pharmacological or medication, we can prescribe modafinil, bupropion, and naltrexone to reduce the meth use in medication side. In non-pharmacological, we do believe that behavioral therapy, such as cognitive behavioral therapies, can help patient identify, avoid, a cope with situation that can trigger the drug abuse, like therapies, different types of therapies. Now, of course, patient education. I do believe in patient education. Meth use is a habit forming. We have to educate the patient about the side effects, about the, short, long term, and what will happen to you or to your patient if they will be in addiction phase. Okay, of course, the disadvantage side. Okay, patient education is the key. Referral. The patient can be referred to an addiction specialist and a counselor for better care. And follow-up, I do believe of follow-up. Okay, don't just refer the patient. Don't just do the patient education or prescribe the medication. In a pharmacological and non-pharmacological side, we have to follow up our patient. Follow up for what? Okay, follow up after 1 week to evaluate the progress, and after that, once a month with a counselor for a cognitive behavioral therapy. Okay, to conclude everything about my presentation regarding meth or methamphetamine. Again, methamphetamine is a stimulant drug often used by individuals in need of energy, reinforcement, excitement, or motivation. Meth abuse is a public health problem right now and affecting 0.9% of population, or a summary of 4.2 million people. Okay, and then meth abuse became endemic from 1980 in California, and it has since spread to the other region. And it has significant health problems, primarily affecting the brain. Effects include cardiac, psychiatric, neurological, and physiological. Okay, and individuals can overdose on meth by using too much of it, and a reaction can be lethal. And a cognitive behavioral therapy is the most effective intervention to treat meth abuse and addiction. And of course, my references are the following, and that will be my end of my presentation. Thank you everyone for listening to my presentation. Have a nice day.